I thought I was protecting my health, but I nearly lost my life. Here's a truth that millions of Americans over 50 have never been warned about. Not every medical test is safe. Some can quietly push you to the brink of a stroke overnight. Imagine you just left the clinic with your report reading, "Everything is fine." You feel relieved, believing you're doing the right thing for your health. But 3 days later, you wake up with half your face numb and your right arm immobile. And then the doctor quietly says, perhaps it was that previous checkup that caused this. A 2023 study in JAMA Neurology reported that 14% of cryptic strokes in people over 70 were linked to diagnostic tests performed within the previous 7 days. This isn't just a number, it's thousands of lives, those who thought they were preventing disease. From the New England Journal of Medicine to the American Heart Association, research shows as you age, your body becomes more sensitive to contrast agents, general anesthesia, and even mild invasive procedures. One rushed decision could mean the difference between a normal day and a lifetime of dependency. In today's video, the channel Advice for Your Life recounts 5 true stories of people who appeared healthy, just went for a check just to be safe, but nearly lost everything. Each story is a life lesson, a clear reminder of how we care for our bodies in our later years. And sometimes living longer isn't about doing more, it's about knowing when to stop. Eleanor Brooks, the ultrasound that took half her life, when trust becomes the start of a tragedy. Eleanor Brooks, age 80, lived in a small Pennsylvania town. She was beloved, gentle, loved baking, every weekend making cakes for neighbors. At 80, she was healthy, only occasionally complaining of lightheadedness when bending over. One morning while pouring coffee, she heard a radio ad, Carotid Artery Ultrasound, stroke prevention for those over 60. She thought, sounds fine, I should do it, maybe discover something early. Her doctor told her, nothing to worry about, just a check for peace of mind. The results showed 62% narrowing of the right carotid artery. Soon after, her doctor recommended open surgery to prevent future stroke. Eleanor signed the consent, believing she was doing the right thing. But 15 minutes after anesthesia in the OR, her heart rhythm went haywire, blood pressure collapsed. The surgery had to stop, and when she woke up, half her right side was paralyzed. Her familiar smile was gone. The partially baked cake sat unfinished, the cold truth behind the white coat. A week later, her daughter discovered a 2022 NEJM study. In asymptomatic patients, carotid surgery does not reduce stroke risk compared to medication and lifestyle, but it increases stroke risk by 3.2% due to surgery. That sentence froze the family. All Eleanor may have needed was blood pressure meds, a healthy diet, and regular monitoring. But she wasn't told that. No one mentioned that surgery for those over 75 carries 4 times the risk of younger patients. No one alerted her that stress and general anesthesia can trigger plaque rupture, leading to acute brain ischemia. Eleanor returned home, speech therapy and rehabilitation ahead. She tried to use her left hand to knead dough. Awkwardly, flour everywhere. She told her granddaughter, I only wanted to check for peace of mind. Now I'm peaceful. I've lost everything. A wake-up lesson for anyone over 60. A 2023 JAMA internal medicine study found that over 40% of Americans over 60 received unnecessary tests, and nearly 20% of those suffered a medical complication within 30 days. Most were caused by lack of clear information and blind trust in the just to be sure recommendation. If your doctor suggests a test, ask, do I really need this test right now? Is there a safer alternative? No surgery? No anesthesia? If something is found, what is the specific treatment plan? These may seem like small questions, but might save you from life in a wheelchair. The Advice for Your Life channel shares Eleanor's story as a gentle yet profound reminder. Preventing stroke isn't about doing more tests. It's about understanding your body, asking the right questions, and not letting fear override reason. Sometimes, the best health move is knowing when to stop. Because living longer is not just about adding years, it's about staying dignified and peaceful every day. William Bill Thompson, when an MRI image changed his life. A hard-working craftsman in the tornado in his brain, William Bill Thompson, age 76, was a skilled carpenter in Michigan. His hands bore calluses, proof of years of labor. At nearly 80, he still drove, still carved wooden chairs for his grandson. Recently, his back had been aching, especially when weather turned cold. Doctor recommended a spine MRI with contrast to get a clearer look. Bill asked, "Is it really necessary?" The doctor smiled. "It's safe. Thousands do it every day." So Bill agreed, laid in the tube, heard the hum for nearly an hour. 5 days later, he started forgetting his grandson's name, repeating sentences, his about unsteady. His daughter rushed him to the hospital. MRI showed gadolinium deposits, heavy metal used in contrast agents. His caudate nucleus controls memory and movement was damaged. When safe is just an illusion, according to Radiology 2024, 5.8% of people over 70 show neurological signs akin to stroke within 1 week of contrast MRI. Gadolinium, labeled safe, is not fully cleared in aged patients with reduced kidney function. It accumulates in brain tissue, causing cognitive decline, tremor, and disorientation. Bill said, "I only wanted to see why my back hurt. Next thing I don't remember how to get home." If his doctor had checked his kidney function, GFR, first, he might have had a non-contrast MRI, safer and sufficient. But like millions, Bill trusted the modern equipment means automatic safety. Research from National Institutes of Health, 2023, warns, in people over 65, gadolinium retention in brain tissue is 7 times higher than in younger subjects. Bill can no longer work wood. The chair he was making sits dusty in the workshop. Each time he sees it, he says softly, "I trusted too much in something I didn't understand." Lesson about alertness and asking the right questions. Bill's story signals a clear message for anyone over 60. Never be afraid to ask, "Can we do an MRI without contrast? Will you check my kidney function before injecting that agent? Is there a safer diagnostic alternative that gives enough info?" Not suspicion of the doctor, but exercising your right to protect yourself. The Advice for Your Life channel shares his story as a lesson in trust and understanding. In the journey of stroke prevention and healthy aging, knowledge is sometimes the most precious medicine. Don't assume safe is automatic. In an aging body, small details can become big risks. And remember, health is not just being disease-free, it's being clear-headed in every decision. Dorothy Clark, a routine check, a mistake unseen, a regular screening, an unexpected wreck. Dorothy Clark, age 81, lived in Ohio. She was the matriarch of a large family, 8 grandchildren, a flower garden, a constant smile. At 81, she was proud to say, "I'm still sharp, still remember well." When the doctor said, "Colonoscopy is necessary for cancer prevention, especially at your age," Dorothy did not hesitate. She thought, "Just do it for peace of mind. Everyone's getting it anyway." Procedure was scheduled Tuesday morning. Doctor suggested light general anesthesia for comfort. She nodded. The procedure took 25 minutes. When she woke up, it seemed fine. But only 2 days later, Dorothy started slurring words. Her hand trembled. She lost balance. Her coffee mug slid off the table. Her son brought her back to hospital. Diagnosis, a transient ischemic TIA after sedation. The science behind the peaceful sleep. According to Gastrointestinal Endoscopy 2023, the risk of TIA or stroke increases 4.1 times in persons over 75 using general anesthesia during endoscopy, especially if they're on blood thinners or have low blood pressure. Here's the hard truth. General anesthesia can reduce cerebral blood flow by 30% in the first 2 hours. Older patients can't compensate as younger ones do. Dorothy had mild hypertension. No one asked if she was on anticoagulants. No one checked her cerebral perfusion pressure before the procedure. And just a light sedation, the comfortable sleep, collapsed her fragile cerebral circulation. Research from the American Heart Association, 2022, shows in persons over 80, merely 15 minutes of anesthesia can trigger microvascular brain changes lasting up to 48 hours. Dorothy was lucky not to lose cognitive function entirely, but she can no longer write her own name with her right hand, cannot tie her hair, cannot cradle her newborn grandchild. Lesson on informed choice and self-advocacy. If she could go back, Dorothy would ask, Doctor, can I have the colonoscopy without anesthesia? Would local sedation be safe enough? With my blood pressure, should I wait until I'm more stable? Those questions might have changed her life. Advice for Your Life shares her story not to scare, but to remind that healthy aging is a two-way dialogue. The doctor has knowledge, but you have the right to ask. In the journey of stroke prevention and aging well, don't let comfort today trade your freedom tomorrow. Every time you sign a consent form, remember, no sleep is truly peaceful if you don't understand what you're consenting to. Robert Bob Wynn, running the treadmill until his heart blew. A healthy man, one test that changed everything. Robert Bob Wynn, age 69, was a long-haul truck driver in Texas. He had driven over 2 million miles in his life and was proud to say, "My heart's diesel strong." Even in retirement, he walked every morning, low-salt diet, no smoking. One day during his annual checkup, the doctor recommended a stress test to check your cardiovascular health. Bob laughed. "I'm healthy, but okay, let's do it anyway." He stepped onto the treadmill with ECG leads on his chest, heartbeat flashing on the screen. The doctor said, "Push a little more, just 6 minutes." By minute 4, Bob's face turned red. At minute 5, his blood pressure hit 210. At minute 6, he collapsed. 24 hours later, he woke in ICU, half his left side weak. The doctor told him quietly, "You're lucky not to be dead, but you've had a minor stroke." When an aging body can't take youthful tests, according to American Journal of Cardiology, 2021, 7.2% of persons over 65 experience major cardiac events during conventional stress testing. For those with carotid plaque or atherosclerosis, the risk is up to 12 times higher. Cause: sudden exertion increases blood pressure sharply, vulnerable plaque can rupture, embolization to brain, an invisible disaster. Bob had slightly elevated cholesterol, but no symptoms. The doctor never checked his carotids or plaque before ordering the stress test. One simple test cost him fluent speech for 3 months. The American Heart Association 2023 warns, in persons over 65, exercise stress testing should not be used if there is evidence of vascular plaque, high blood pressure, or diabetes. After recovery, Bob now walks every day, slowly, mindfully. He told his grandson, "Health isn't proving you're stronger than others. It's knowing when to stop before it's too late." Tiny question, huge difference. Advice for Your Life emphasizes, not all heart tests need a treadmill. Safer alternatives exist: resting echocardiogram, pharmacologic stress test, no treadmill, non-contrast cardiac CT for older patients. Before stepping on the machine, ask 1. Can I have a pharmacologic stress test instead of running? 2. Is my heart strong enough for this test? 3. If the result is abnormal, what's the next step? Bob's story is a wake-up for millions over 60 who believe more testing means longer life, because sometimes one wrong test can cost you the rest of your life. Linda Hayes, a mild pain, a decision that cost her morgue. A light pain and the wrong move. Linda Hayes, age 72, was a retired teacher in Florida. She loved orchids, walked her neighborhood every morning. Her health looked good, except occasional mild pain in the left side of her abdomen. One Friday, her daughter urged, "Just a CT scan, Mom. 10 minutes and we'll know." The doctor agreed. "We'll inject a contrast agent so the image is clearer. Totally safe, don't worry." Linda lay on the scanning table, needle in her arm. As the contrast entered, she felt a warm rush through her body. Odd, yet fleeting. The result came back normal. She left relieved, thinking she'd done the right thing. 3 nights later, she woke up. The world tilted, her left eye blurred, left arm numb. Her daughter called 911 midnight. In the ER, the doctor said, "You've had an ischemic stroke, possibly linked to the contrast agent." When clearer image doesn't mean better outcome. According to Journal of Vascular Interventional Radiology, 2022, in individuals over 65 with hypertension or vascular plaque, Contrast agents containing iodine raise stroke or vascular event risk by 340% within 72 hours. Mechanism: iodinated contrast triggers acute vasoconstriction, raising intravascular pressure by 50 to 80 millimeter Hg. Vulnerable microvessels rupture or occlude. Linda had mild hypertension and high cholesterol, but on the day of the CT, no one asked or checked her blood pressure. Just 10 minutes of 4-Clarity injection cost her part of her sight for life. After leaving the hospital, she had to relearn orientation. She still walks each morning, but now with a cane in her right hand. Looking at the orchids in her garden, she says slowly, "The one thing I wanted to see clearly is the thing I can't see anymore." When a clearer picture doesn't mean a healthier life. According to the American Heart Association, 2024, tens of thousands of strokes each year are linked to contrast-based imaging in older adults. Many are preventable with a simple question: "Doctor, can we do a non-contrast CT? Do you need to check my blood pressure or kidney before the injection? Is there a safer alternative like an ultrasound or non-contrast MRI?" Advice for Your Life shares Linda's story as a sharp reminder for anyone in middle or older age. In the journey of stroke prevention and healthy aging, sometimes the clearest image on film becomes the thing that makes real life go blurry. Don't let a hasty medical decision take away your sight, your family's laughter, your peaceful mornings. Because true health isn't in the test result, it's in the awareness and control you hold. You are the one who decides your life. 5 stories, 5 people, 5 costly lessons. Eleanor lost half her body to an unnecessary surgery. Bill lost memory to a contrast MRI. Dorothy woke from a peaceful sleep but couldn't hold her coffee again. Bob collapsed during a heart test just 6 minutes. And Linda, who just wanted to see clearly, ended up living the rest of her life with one blind eye. They all had one thing in common. They thought they were protecting their health. But in the effort to prevent disease, they forgot one important thing. Not every medical test is safe. Not every recommendation fits your body. Top doctors from JAMA Neurology, NEJM, and AHA agree. In people over 60, contrast agents, general anesthesia, and stress tests can raise stroke risk, cause temporary memory loss, or damage brain vessels. That doesn't mean you should fear medicine. It means you should be more alert before each decision. 5 life-saving questions for anyone over 60. Next time your doctor recommends a scan, a test, or a procedure, pause for a moment and ask yourself and your doctor. 1. Is this test absolutely necessary right now for me? 2. Is there a safer alternative? No contrast, no anesthesia, no stress. 3. What's my risk of stroke in the next 72 hours with my condition? 4. What do I need to prepare before the test? Kidney check, stop blood thinners. 5. If the result is abnormal, what's the exact next step? These questions are not about doubting your doctor. They're about taking responsibility for your body and your future. Final message. From heart and mind, you deserve to live to 90, 100, with a sharp mind, steady steps, a warm smile around your children and grandchildren. Don't let one rushed medical decision steal that away. Advice for Your Life hopes that through these stories, you'll remember, health isn't waiting in a hospital corridor. It's in how well you understand your body. Because sometimes the best way to live longer isn't doing more. It's knowing when to stop. Video disclaimer. This video collects and synthesizes knowledge for sharing life lessons and health risk awareness and spreads positive values for living. If you feel this video hits something in your heart, please hit like to support those spreading life knowledge for everyone's health and longevity. If you believe these messages deserve to be known more widely, please click subscribe to the Advice for Your Life channel so you don't miss real-life stories, valuable health lessons, and top doctor advice for 50-plus age. Every week, Advice for Your Life brings you new videos on stroke prevention, senior health, healthy aging, and habits to help you live longer, healthier, more meaningful. Search YouTube or Google Advice for Your Life, your home for real stories, human wake-up calls, and the power of informed choices for healthy living each day. Hit like, subscribe, ring the bell to join a community learning how to slow down, stay strong, and stay smart every single day. Because sometimes one video at the right moment can change how you live the rest of your life. Here's the channel's retelling: real people, true stories, worst case lessons, so you live better.